Good morning. My name is TR. It says Tiffany on the student roster, but I go by TR. So I am out of North Carolina. We had the hurricane last night and everything is well here. So just waiting to hear on our coastal areas to see what the damage is. But been following the news. I'm sure the rest of the country is. So here everything is fine, thankfully. I am a pediatric physical therapist in an outpatient clinic. I currently own a few practices in the Raleigh area. We serve children birth to 21 through the early intervention program, but primarily outpatient therapy. We have occupational, physical, speech, and feeding therapy in our practice. We have 2 locations, and we're discussing opening a third. This area is very popular for families to move here with special needs. It is home of the TEACH program. If you're familiar with that, is one of the programs that kind of address the way that children with autism learn. It's kind of almost the counter product of ABA. So some children do better with TEACH, some do better with ABA. So in terms of academia, I am adjunct faculty at Methodist Physical Therapy Program in Fayetteville, North Carolina. I teach the pediatric physical therapy coursework starting in January. So the spring semester of each year for the second year students. And so I can say this class, this program's picking up from neuro last semester, but this entire program has changed the way I teach and more so my presentations, my content, and it has been beyond helpful. So my expectations from this class are to take what we learned last semester, expand it, and put it into clinical practice. I'm halfway through the article on cerebral palsy and cortical spinal tracts, which I found fascinating. Seton knows this about me as well, but I tend to love the details and get really caught up in the details almost to a fault, but I like to understand why, and I won't leave a topic until I understand why. So I'm hoping this class gives me that aspect. Already just reading yesterday about the different weeks of gestation and the brain and learning about trying to find classifications for cerebral palsy spoke to me, and I found that very fascinating as well. What I am probably the most concerned about this class is almost the same thing that I'm excited about, is getting caught up in the weeds. It looks like a heavy coursework semester. We have 9 credit hours, and I just want to make sure that I know what to spend time on and what not to spend time on, just to make sure that I have quality in my work and not just stay focused on one topic like I tend to do. So that is me. My current dissertation desire is in the brachial plexus arena. That has been a common practice for me for the last 15 years as brachial plexus specialist perinatal. And I teach on that. I've lectured on that and do some continuing education on that as well. I also am into learning more about different diagnoses, but primarily etiologies. As I said earlier, I'm, again, very fascinated on the cerebral palsy diagnosis. That has been my love and passion since I've been a peds therapist, this is my 20th year. So I really want to understand more of what I'm treating, not just treating. So, and then with students, they're always asking when they transition from adult neuro to peds, they come to our clinic, well, why does that patient have this presentation versus that patient when they both technically have diplegia, cerebral palsy? So I feel like this coursework is going to kind of give me some answers to that for myself and also for teaching, which often then comes back to me to become the better student as well. So I'm looking forward to this class. I loved neuro last semester. It was definitely challenging and humbling, but I feel like this is the course that we signed up for to kind of keep us moving in the path of becoming specialists. All right. Thanks so much. I look forward to the semester.